Welcome to SLP Nerdcast, your favorite professional resource for evidence-based practice in speech-language pathology. I'm Kate Granbois.
And I'm Amy Wonka. We are both speech-language pathologists working in the field and co-founders of SLP Nerdcast.
Each episode of this podcast is a course offered for ASHA CEUs. Our podcast audio courses are here to help you level up your knowledge and earn those professional development hours that you need. This course, plus the corresponding short post-test, is equal to 1 certificate of attendance. To earn CEUs today and take the post-test after this session, follow the link provided in the show notes or head to slpnerdcast.com.
Before we get started, one quick disclaimer. Our courses are not meant to replace clinical advice. We do not endorse products, procedures, or other services mentioned by our guests unless otherwise specified.
We hope you enjoy the course.
Are you an SLP or related professional? The SLP Nerdcast Unlimited subscription gives members access to over 100 courses offered for ASHA CEUs and certificates of attendance. With SLP Nerdcast membership, you can earn unlimited CEUs all year at any time. SLP Nerdcast courses are unique, evidence-based, with a focus on information that is useful. When you join SLP Nerdcast as a member, you'll have access to the best online platform for continuing education in speech and language pathology. Join as a member today and save 10% using code NERDCASTER10. The link for membership is in the show notes.
Hello, everyone. Welcome to SLP Nerdcast. We are very excited for today's episode. My co-host Amy is not joining us today, but I am not alone. I am here with another SLP Nerdcast teammate, Anna Paula Suzamui. Hello, Anna Paula.
Hello. I'm so happy to be here.
We're really excited to share your wisdom. You are here to talk to us a little bit about supervision and what you very eloquently called the Supervisory Alliance. Before we get into all that, can you tell us a little bit about yourself?
Sure. I am a program director and associate professor at a small private university. But really prior to this position, which is what, or the experience of the clinical supervisory experience that I have that I'm going to be talking about today comes from my work prior to this position where I was a clinical assistant professor and was the supervisor for a preschool program at the University of Kansas. So that's where I was before, and I'm excited to just talk about my experience there.
I have learned so much from you in the time that you've been on our team. I'm very excited to, as I said, share everything that you know. Before we get into it, we do need to read aloud our learning objectives and disclosures. So here we go before we get into the good stuff. Learning objective number 1, identify key components of the Supervisory Alliance. Learning objective number 2, explain attitudes, behaviors, and practices that contribute to an effective supervisory alliance. And learning objective number 3, describe the impact of a positive supervisory alliance. Disclosures, Anna Paula's financial disclosures. Anna Paula is employed at East Texas Baptist University and serves as the ASHA administrator for SLP Nerdcast. Anna Paula's non-financial disclosures. Anna Paula is the president of Spiro Stuttering Incorporated, which is a nonprofit organization. My financial disclosures, I am the owner and founder of Granbois Therapy and Consulting, LLC, and co-founder of SLP Nerdcast. My non-financial disclosures, I'm a member of ASHA SIG 12, and I serve on the AAC advisory group from Massachusetts Advocates for Children. I'm also a member of the Berkshire Association for Behavior Analysis and Therapy. All right, now that the boring stuff is behind us, I would love to hear a little bit more about the Therapeutic Alliance. I've heard the word alliance before, obviously, but never in the context of supervisors and supervisees or even really in therapy. So what can you tell us about that to kind of set the tone for the conversation?
Mm-hmm. The Therapeutic Alliance is really a way to think about 3 different areas that are important in the therapeutic relationship. And so the first being that client-clinician bond. So thinking about your belief in that client, their ability to make changes, whatever changes are important to them. And then also that positive regard, which includes supporting them, their values, their beliefs, and really just, walking alongside them in whatever goals that they have for themselves, which kind of leads to the next one, which is really agreement on goals. So thinking about, are we dictating what goals they want, right? Or are we listening to our clients in what is it that they want to see different, right? How is their communication disorder or difference impacting them negatively? And what are some goals that would help them achieve greater quality of life, right? And then the third aspect being agreement on what are the tasks or what are the processes to accomplish or reach the goals, right, that are set. And so having the ability to experiment, exploring ideas or techniques or strategies or whatever that might be. But so that's in a nutshell, just what that therapeutic alliance consists of. And I don't know if you want me to go ahead and go into like how I have now framed it into the supervisory or thinking about the supervisory role that I was in for a really long time. And I will say that I started supervising students from the moment I became eligible after getting my Cs. I loved working with students. I was in Wichita, and there was a university there that was looking for individuals that, wanted to work with students. And I'm like, yeah, I'd love to. And so I started right away as soon as I could. And then I've done a lot of both at that time, I was an external supervisor taking in students, and then also CFs at times, supervising clinical fellows. But then of course, within my role at my previous university, that was my primary role, was to do clinical supervision. And so I just began thinking, how there were parallels, right, between like how we function as clinicians and thinking about, oh yeah, I have to keep these things in mind. How does this translate, right, to the supervisor, supervisee, or the clinical supervisor clinician relationship? And so that's where I just began thinking about this, paradigm, if you will. And so, and then realizing really, they're essentially the same, right? Just having that supervisor, student, clinician bond, how, my belief in that person, right? My belief in them as a student and their ability to grow and learn in this profession. And then also, what are their learning goals? So of course I have learning goals or things that I want them to achieve, but at the same time, thinking about how they also have goals for themselves, things that they want to achieve and how they want to grow. And then what are the tasks and the processes to reach those goals? So I, again, as the supervisor, have some ideas of what those tasks might be, right? And what that process might look like, but at the same time, getting their buy-in into, this is what we're doing in order to help you move to that next level.
What I love about this parallel that you've made, so first, in thinking about the therapeutic alliance with our clients, this is very much our patient-centered care model, right?
Mm-hmm.
So the third of
Right.
our evidence-based practice triangle, client perspectives and values, walking with the patient, letting them have, making sure that our goals and objectives are aligned with their values, what's meaningful to them.
Mm-hmm.
What I love about this in mapping this onto the supervisor and supervisee relationship is it puts the supervisee in a position of empowerment to be a
Mm-hmm.
contributing partner in their learning journey. And as many of us have had, as many of us have experienced in the past, when you have a supervisor that is just, as I say, shooting all over you, like, well, you should do this and you should do that and you should do this. And you're not given space to be who you want to be or to challenge your own thinking or to work towards your own goals, it can feel really, maybe I'm speaking from my own experience, but it can create a lot of tension. And I love that you've put the supervisor, and I love that you've put the supervisee in a position of empowerment through this alliance, because at the end of the day, if you're in a learning environment, you have to feel safe to be vulnerable, to make the mistakes and do all of those things. I love that parallel. I think it's awesome.
Mm-hmm. And if you think about in the same way with a therapeutic alliance, it's all about the relationship, right? It's building rapport and having this relationship where you are listening and you are, open. And I think in the same way with clinicians or students, it's about the relationship. It's about building that rapport with them as well, where they feel like, yes, you're on my team, right? Like you are going to be giving me feedback that maybe will be hard to implement, or maybe that will be hard to take at times or whatever. But when they, I think, believe that you believe in them, right? And that there is that relationship that's reciprocal in a sense that then it's easier to navigate, especially when they are maybe having challenges or when there are struggles or, they're overwhelmed or I think the relationship is really at the center in both situations, right?
You also, in a lot of your talking points here, use the word bonding, which I think is a great word. How can you elaborate on that for us?
I think within this concept of bonding is, I think the first thing that comes to my mind is we're both humans, right? We're both living this human experience. So yes, maybe I'm in a position of power because I'm the supervisor, right? But I'm also a human being. I'm a mother, I'm a wife, I'm a friend, I'm a colleague, I'm all these things. And I also have experiences where I struggle or experiences where I maybe doubt myself or feel inadequate or, there's all these things that I think, so bonding in the sense that, I try to be a person first, right? To them to say, I am here to listen. I do care about you. I want to get to know you. So it's not just about this clinical relationship, but it's also I want to invest in getting to know who is this person in front of me, right? And what are their interests and what are the things that they're excited about? Or, do they have a family? Do they have, most of our students generally aren't married, but the ones that are they married? Do they have kids? So just really kind of getting to know the person and then allowing them to get to know me as well. Of course, there's still boundaries within that relationship, but I think just seeing each other as humans, right?
I have to imagine that many people who are listening to this episode are either in a position of power. So you're listening and you're a supervisor, or maybe you want to be a supervisor,
Mm-hmm.
or maybe you're listening and you're a supervisee and you feel grouchy feelings about your supervisor, or you already have a supervisor and you're reflecting on your supervisor-supervisee relationship. One of the things that you just said that we've talked about on this podcast before, and I promise not to get on my own personal soapbox about it because it's a passion topic for me. But one of the things that you brought up that I love so, so, so much is that if you are in a position of power, if you are in a position where there's a power differential, and one of the most important things that you can do is embrace, this is my favorite term, embrace professional humility.
Mm-hmm.
So understanding that no one knows everything. There are things that even you need to still learn. Checking your ego at the door, being comfortable in your discomfort, right? Those things can create such examples of strength, and create a lot of much more comfortable feelings for others around you. And I think it is such a sign of strength and a sign of leadership and such a wonderful quality to have when you are in those positions. So tiny little soapbox. I just wanted to say, here, I completely agree. And I love that you brought that up because it's so important. And thinking about that in the context of bonding is awesome, because how are you going to develop one of those, wonderful relationships if you don't approach it with curiosity and humility, right?
Right. And I think that goes hand in hand also with vulnerability. So just being willing to be vulnerable. And I know for me, for example, in team meetings or in different situations where I may share, my own mistakes in my clinical development as a therapist, right? Where this happened or that happened, and being able to just share, here's how I learned something the hard way, right? Or even, talking about my emotional responses to client situations that maybe I wasn't prepared for, or ways that, I grew in that sense, or and I guess bringing it back to like the human piece of, difficulties with work and home balance, and, other challenges that, I have faced, as a professional, as an SLP. And so I think just that openness, that vulnerability, just to be a person in front of them and say, yeah, I've, and like you said, I'm always learning, like that lifelong learner. That's not just a cute term. Like, I'm literally a lifelong learner. I have much to learn yet. And so just, I think modeling that for them is really important.
I totally agree. And I'm wondering how all of these things, all of these wonderful philosophical guideposts that we've mentioned, I wonder how that contributes to the experience of someone. What can you tell us about different variables like this and different elements that can contribute to a positive supervisory experience?
I would say, again, central's relationship, right? That's key. And in a practical sense, I would say that there are some things that I think about. So, for example, for the student to be successful, clear expectations have to be present. So they have to know what it is that they're expected to do. And it's our job, right, to make sure that we're communicating that in a very clear way. And then also thinking about, what are the students, or that particular students, what's their level? Like, they're coming in at a certain developmental level or experiential level, right? So just thinking about that our expectations are matching, in a sense, their level. So where are they at? Because of course, students come to us with different experiences and at different levels. So you just have to be really aware of that. And I would say just being able to scaffold, their learning, and giving them that constructive feedback at different points, within their journey, but making sure that they're also frequent, right? So making sure that we're being really mindful that students, even though sometimes feedback is hard to receive, they want that feedback. They need that feedback. And so just being able to, provide that with frequency, and then creating a safe space for them to make mistakes, right? So knowing that mistakes are opportunities to grow, right? We learn when we make mistakes. Actually, somebody was asking me the other day about how have I learned in my new role as a program director to, such and such or whatever. And I said, honestly, from the mistakes that I made. And that's how I've learned, the most. And so just really being able to view those as a positive thing, and just those learning opportunities that come with it.
And something that you said just then resonated with me about how every student comes to you with a unique set of skills, a unique learning level, unique needs of support. And I think that's so true. And you have a quote in your talking points that really resonated with me, and I'm going to read it. The quote is, "We must teach the students we have and not the ones we wish we had." And that is a quote by Tony Holland from the book Establishing Leadership Mindset, a guide to using the power of the human brain to motivate learning. And one of the reasons I love this quote is that, as clinicians, we are trained to meet our learners where they are, right? So you do an evaluation. I'm in pediatrics, so that's the example I'm going to use. You do an evaluation on a child. You have a good understanding of where they are in their language learning, and you write goals and objectives to meet them where they are. Adults are learners too. And we often forget that we need to meet all learners where they are, including our students. And I have had this experience myself, just as a supervisor, feeling oh, this person I'm supervising I'm feeling frustrated because they really don't know X, Y, or Z. And this really seems to be a concept that they're having a difficult time grasping. And that is not a great reaction because I need to adjust my expectations to meet them where they are, as opposed to having expectations that they fall short of. Would you say that that's a fair statement?
Yes. And I think I love that quote as well. And it's one that I repeat to myself often, right? Because of course, when students struggle, then there is more work, right? That's involved in whether it be, like you said, you having to realize like, oh, I need to adjust here, or I need to do more of this, or, it does take more effort and intentional changes, right, that you have to make to the environment. And, but at the same time, it's like honoring who's the student in front of me, right? So realizing they're going to come with different, personal factors, personalities, cultural experiences, even experiences, clinical experiences, right? Because some grad students have had clinical experiences at the undergraduate level. Some have not, right? So some of them come with maybe a little bit more preparation than another. They also come with different insecurities and different questions or doubts, right, about themselves. And so there's just so many variables that are at play that you really just have to almost like just be willing to say, yes, I'm going to accept you as you are. You come to me, right? It's the students I have, not the ones that I wish I had, in the sense that, of course, like when we get those, the type A, like go-getters, who are just, independent and, all this, of course, that's easier, right? It's, I think about, raising kids, it's easier when you have the perfectly compliant and never questioning whatever child, right? And yet that's not reality. And it's so just being able to look at them and say, okay, this is what you come to me with, and we're going to figure out how to walk this, together. And being willing to go the extra mile to brainstorm, when, especially, of course, this comes up when they're struggling, right? So when they are struggling, why are they struggling? And why are they having a hard time responding to the feedback? Or what is it that is creating, those barriers? Or do I need to be more explicit? Which I'm going to say the answer is always yes. Yes, I need to be more explicit, right? Which we'll talk about a little bit later in how do we make things explicit in terms of expectations and what we're asking them to do, giving them examples. So just, I think that answers your question, but, I just think that we have to just leave our expectations at the door, in the sense of like, oh, I want you to be this, and just really be willing to grow with them, right?
I also think that, I can see the role of the relationship there, right? So if you are in a position where you're getting to know the student, you're realizing that they're having a harder time, you're concerned that the feedback isn't being given in a way that's well received, or you need to be more explicit. If you have a good relationship, or if you have spent the time investing in that relationship as a human with kindness, I have to imagine that those other points of conflict are going to be, improved upon, or those points of
Right.
conflict are going to become less contentious and less negative because you have this great foundation.
Right. Absolutely. Yeah, I agree. I think that usually, when there's resistance in any way due to whatever, factors might be present, there's usually an explanation, right? Like there's something there, and just being willing to, uncover what that might be. And in the context of that relationship, it's certainly easier.
So, what are some of the challenges that we face in terms of adult learners? And, aside from probably the obvious, like restrictions on time in the workplace and, some of the infrastructure barriers that we all inevitably butt up against, what are some of the general challenges in your experience that you see in a supervisory role?
Mhm. I would say that the two, if I was to put students into two categories, when there is conflict that's present, usually it's either because there's underdependence on the supervisor where they think they have it, they've figured it out, right? I don't need supervision, I've got this. Or overdependence where they lack confidence, they're afraid to jump in and do what you have equipped them to do, and there's, again, self-doubt or insecurities for whatever reason. And so dealing with, underdependence, where maybe they feel like they know more than they know, that's probably harder, because there's maybe ego involved or some, a pride factor maybe, and it's just, I think, gently being able to them like, here's what I am wanting you to learn from this experience, or maybe just explaining the why behind something. Like, I'm asking you to do it this way, even though I know that you might want to do it this way, but I'm asking you to try this in order to XYZ, right? So like giving that the reason behind something. And then on the other side, when there's maybe lack of confidence, or if they're afraid or whatever, is getting down to like, why is that, right? And what is it that you need? So for example, sometimes, so in the preschool program that I was in, where I supervised students, they had gradual expectations in terms of like how they moved along, in how much they were leading. So they had one-on-one interaction with their clients that they were assigned to, but then they also were leading things like story time or opening circle, because, we were in a preschool setting. And for some of those students, even though, your audience is 3, 4, and 5-year-olds, they still were terrified, right? Because they had to essentially run, that segment of the day. And that can be scary, and they're
I
afraid.
remember being
So,
terrified. I
yeah.
remember being absolutely terrified.
And you think, hey, it's a forgiving audience, right? They're 3-year-olds. They're not going to mind. They're not going to notice, right? And but I would say that to them. I would remind them and say, hey, these are, you have a forgiving audience. They're going to love you regardless of what you do. They're never going to notice that you made a mistake, right? So just, I think sometimes affirming those things and saying them out loud and being able to tell them, and always reminding them, like, this is a safe space for you to make mistakes, especially when you're talking about a preschool classroom. It's a very safe space to make mistakes, even though they don't
And
feel
pick your
that.
nose. No, I'm just kidding.
Yes.
It's a preschool
Lots of things
classroom.
happen, right? In a preschool classroom.
Right.
But just reminding them, like, there is no expectation of perfection. There is no expectation that you're gonna get it, the very first time that you try, or that it's gonna go beautifully. Because even the most well-planned, well thought out, whatever activity that you come up with, you're talking about engaging with, 3-year-olds, 4-year-olds that are going to do what they want to do, right? And so just reminding them, like, even though you may be prepared, things are going to go a different way, or they may not respond, and it always happens that, the things sometimes that you plan that you think, oh, they're going to love it, and then it just kind of like falls flat. And then the things that you're like not so sure that they just adore, right? So like just having that tolerance for not knowing, but I think the more we talk openly about those things that they can expect, like, it's going to happen, right? And or you're going to have to deal with behavior issues, or you're going to have to deal with the child who maybe occasionally wants to bite somebody, or the child who wants to run around the room or whatever, so just talking about like, here's what to expect. Like, it's organized chaos, in many ways. Of course, I'm talking about the preschool setting, but
Right,
just
right, right.
in whatever setting that you're in, preparing them for the variables that are there, and helping them realize, like, okay, I it's not going to go perfectly, and that's okay. I don't have that expectation. And I tell my students all the time, I would tell them, I just want to see that you're growing. I just want to see that from day to day that you're here, from week to week, from month to month, that I'm seeing progress. And as long as that's happening, I'm happy, right? And I want, and I'm just going to continue to support you, but I want to see that you're, you know, building rapport yourself with your clients and building rapport with the other students, and, being just a part of this, therapeutic environment that, of course, in a preschool setting is very naturalistic, which makes it a little bit challenging too.
Sure. So going back to those two general categories where, you may have a student who is overly confident in their skills and feels that they need less support, or is has a lack of confidence and is feeling like they need more support than they actually need. It's making me, I feel like I've met other professionals who are non-students who have the same profile. So I feel like this, how to approach a learner based on these two general categories is probably very helpful for anyone listening who is supervising, even, not even necessarily grad students, but newer grads or CFs or, people who are earlier in their careers. And I'm wondering if you have suggestions for what support strategies are more or less helpful across those two categories.
Gosh, I don't know that I would necessarily divide them based on the two categories, because I don't know, because I think it applies maybe to all, but just at different levels. So if I was to say, what are like the three things that I think are just essential, when it comes to supervision, I would say macro affirmations is one. So thinking about, which I'm just going to read the definition because I feel like I'm going to butcher it if I just try to talk through it. It's defined as tiny acts of opening doors to opportunity, gestures of inclusion and caring, and graceful acts of listening. So in that sense, it's, asking for student input, being willing and curious about what do they think, and what ideas do they bring, right? And then recognizing their achievements. So naming the things that you notice, right? Being a good observer about the positive things that you see, which is also good parenting, right? I'm thinking about my kids as I'm saying this. I'm like, oh, noticing the positive and, stating it out loud.
Right.
But, taking an interest in their lives, and just affirming them, in different ways, giving credit to their ideas. I think all these things contribute to just them feeling affirmed, right, as an individual and as a clinician. So I think either student, in either category are going to respond to that, right? And then clear expectations. I cannot state this enough, just clear learning objectives.
Explicitly clear.
Gosh. Yeah. Assignments, having, clear deadlines, and giving them examples of, like, for example, and I'm going to tie it back to the preschool. One component of what we did during opening circle was we would make a word come to life. So we had these, words, target words that we were teaching that tied to the story time, that were tier 2 words that we were trying to help them learn, but also infuse into our natural interactions and infuse in different opportunities. And so anyway, there was just a very specific way that we would instruct them to kind of make these words come to life. They could use different things. They could use video or tangible things or audio. They could really present the word in any way, but it had to be very interactive, right? And of course, students would struggle sometimes because, one, you have to, if you're defining a word, for a preschooler, it has to be very child friendly. It has to be very, you can't use unknown words to describe an unknown word, right? Like there's factors that you have to think through. And I would, model for them what that might look like. But then I realized, like, they need a script. They need a script that they can look at so that when they are coming up with their own way, they realize like, oh, this is what she means, right? And I would show them like, you're going to introduce the word, you're going to give the child-friendly definition, you're going to repeat it several times, you're going to model it or demonstrate it in some way, you're going to do it, and by giving them that script of that would show them like, here's what it's supposed to look like, then when it's their time to do it, they can do it, right? And they know exactly what's expected. And I literally began doing that for every single segment that they had to lead. So we did it for story time. We had very clear guides and scripts when necessary of like, okay, here's what we want it to look like. Music time, even, it's like music time, especially in a language rich environment. We're not just singing, twinkle, twinkle, little star. Like we want clear targets for the songs that are chosen. We want it to be age appropriate because these are little ones. We want it to be repetitive. We want it to be this. So then again, like I gave them this framework for what's music time supposed to look like, and sometimes you feel like it's overkill, like, oh my gosh, like, do they really need all this? But they really do, like, and that just helps with giving them those clear expectations. And even, in other practical ways of meeting schedules that are clear, like when are we meeting, when are we not meeting, like not being, like all over the place with deadlines or, all of that. And then, so like, I'm big on, cheat sheets or guides, whatever. Just, I probably go overboard when it comes to, making sure that they have a model, or if it's, let's say, a report that they're supposed to write, that they have a model of like, here's one that has been written. This is what we're looking for, right? So that's the second component. And then I would say the third would be feedback. So fair, specific, timely feedback, making sure that we are being consistent with that. And for me, I felt like written feedback, even though I would sometimes give them verbal feedback too, that written feedback that they can go back to and look at and reread and ponder. And so I would sit sometimes in the classroom and have my little, I had my iPad and I would just be writing. And then I would clean it up and just making sure that, it was clear, but it was very time intensive. However, my students really benefited from that. And they would say, because sometimes like in our team discussions, I'd say, what resonated with you the most, from the feedback, or what did you learn, and say, oh my gosh, that was so, it just helped me see this, or, just, one, I wanted to make sure that they were reading my feedback, but also,
Right.
making sure that it was, helpful to them. And then I would ask them like, is there a way that you would prefer, or would you prefer feedback in a different way? Or is this helpful to you? Is there more that you need or less that you need? So just seeking their feedback on, is there something I need to add to, and then of course, just helping them build on their strengths and then grow in their areas that they're struggling. So I always start with, I love that you did such and such, or I really like seeing such and such. And so just starting with the positive, and then for anything where areas of struggle, I would say, you might try this, or I noticed that you did such and such. Maybe, it didn't go so well. I wonder if, so even though I'm saying you really should try this, I'm also suggesting like, and bringing their attention to, this didn't go so well. What can we do to make it better? So that I'm not saying like, no, that's wrong, you're horrible, that's terrible, but I'm saying, I noticed this. So just having that observing language, if you will, of here's what I saw, let's try something different and see if they might respond better, so I think feedback is crucial. And then the feedback component also, I think, ties to, just what are the necessary tasks and the processes. So where do I go from here, right? Because we have, I also talk about the cycle, right, of feedback and practice, and what does that look like? And I don't know if you want me to go into that now. Is this
Yeah, I would love to hear about that. I also, I think the only comment I wanted to make was as you were talking, I had this kind of moment putting two and two together, going back to what you said earlier, making parallels between us as clinicians and our clients. Because when we are working as clinicians, we are taught explicitly to set our clients up for success, right?
Yes.
To provide lots and lots of support because it is very easy to peel away the support once it's there. But if you don't want to set up, create any alliance or any therapeutic situation where you're setting someone up to fail, letting them fail and then intervening with the supports. And I can see this parallel here where it was when
Absolutely.
you said you don't think that they need that much support, but they do. Even if you don't think they do, providing it as part of your regular modus operandus, of supervision,
Mhm.
and then removing it more slowly or as they need it just sets a supervisee up for so much more success than just kind of waiting and seeing. I can't imagine that you'd want to wait and see. I just wanted to make that comment because those light bulbs went off for me while
Yeah.
you were talking, but I would love to hear about the cycle of practice and feedback.
Mhm. So I'm, again, very explicit about, what is the purpose of what we're doing. So with practice, of course, anytime that they're with a client, whether it's one-on-one or within the preschool setting, they're getting to practice, right? Their clinical skills. So we talk about how, practice leads to that observed performance. So I'm going to be observing their, and I hate to use the word performance because it's not like they're performing, but essentially we're evaluating them, right? We're observing and we're giving them feedback. And so that observed or observing of their skills leads to or allows for that targeted feedback. So you're giving them that feedback, which then, of course, the hope is that it's going to guide their further practice. So there's this cycle of, practice to being observed to that feedback, back to practice, right? And of course, the goal in the end is that one, maybe they're needing less and less of that targeted feedback because they're getting it, they're learning, they're making changes, they're growing in their skills as clinicians. But still, so of course your feedback is going to change over time, but it's just crucial that that cycle just be continuous, that there's just always, and of course at the beginning of the semester, I'm going to be doing it way more often than, towards the end of the semester, or if not, there's a problem, right? Like if I'm giving the same level of feedback at the end as I was at the beginning, then we know something did not go well. But for most students, of course, you are changing the way that you provide that feedback. Maybe they don't need it as often, or you don't have to be as detailed, or it can be that you're giving a lot more of just those positive notice, the positive noticing, like, I love that you did this, or yes, you got it. Like, this went super well and you are really tuned to the students in that moment, or, you really infused or, incorporated such and such that we talked about in our discussion the other day, because at least for the preschool, each week we would have these 2-hour team meetings where we would discuss, what's going well, what's not going so well, brainstorming about clients. But then also we would have readings that we would cover that would relate to different aspects of what we're doing. So literacy type, like readings related to literacy or vocabulary growth, or language facilitation strategies within a naturalistic environment, right? So we were, all of our discussions related to things that they needed to know and learn and utilize, right, in their day-to-day as clinicians within this particular setting. And so when you see them putting into practice, right, some of the things that we've discussed, it's like, yes, you're getting it. And then, and you can affirm that. But then of course, if you don't see it, then it's pointing them back to, remember when we talked about, such and such, this is what I want to see. Or we did a lot with dramatic play. So that was huge, within a naturalistic setting of how do we help children, preschoolers grow within the context of these dramatic play experiences, that are very much free, and, there's not necessarily a script there, but you can be very attuned to what's happening and how can you facilitate language in that context. And so one thing that I would do sometimes related to language facilitation is I would take like a 10-minute block of time where I would observe them, and I would jot down like how many times they either like recasted or expanded or used, one of the strategies that we've talked about, narrated or whatever. And of course, towards the beginning of the semester, it's like, 0, 1, maybe 2, or, whatever. And then they're like, oh my gosh. And they also generally use a ton of close-ended questions where it's just, prompting for these yes, no, or one-word answers. And of course, we know that that's not really good for language facilitation. And so it's a very eye-opening exercise where they're like, oh, wow, I didn't know this. Like, I really need to, beef up some of the other things that we're doing. And so then we talk about, okay, so what is a language facilitation strategy that you want to focus on and increase, right, for this week? And then maybe, 2 weeks down the road, I would do it again. And then inevitably, most of the students, they're much more self-aware and they're using more of those strategies, right? So, but the exercise of, sitting down and logging it, it's not to shame them. It's not to say, oh, you're not doing enough. It's to say, here, become aware of what you're doing currently, and then what do you want to do more of? What can you do more of? What can you learn to naturally do more of within this context, right? To facilitate language. And then obviously they're always proud of the fact that within a couple of weeks to 3 weeks, they're doing more of it. And they're like, yes, I'm learning. And so it's never meant to be a negative of noticing like the bad. It's just like, okay, here's where you are and here's where we want to get.
And not again to make that analog, but we take data on our clients' learning.
Right.
I mean, this is your data collection strategy to measure progress.
Mm-hmm.
And that I think that it's science has proven that measurement is an effective strategy for behavior change across everything, across smoking cessation, across fitness, across, you name it, there is some measurement strategy. And a quote that I love, actually, I think it's from like the business realm, but what gets measured gets managed. And I think that this is a very, very good example of that. I'm wondering, I mean, you've reviewed feedback strategies, you've talked about the cycle of practice and feedback loop. You've talked about all of the key components of a supportive environment, investing in the relationship, professional humility. I'm wondering if you have any words of wisdom for when things are not going well. If there is conflict, you've spent the time investing in the relationship, you've approached a problem with professional humility, but there is still a sense of your feedback is not being received well, or there are clear points of friction, or the student or supervisee doesn't think they deserve your feedback, or is affronted by it or insulted. There is some point of friction. What do you do in that situation?
That's a hard question to answer, but I will.
I didn't mean for it to be a trick question.
No, it's just that, there's just so many variables that create sometimes that conflict, right? And so I think the first thing that would come to my mind is communication, is approaching that student to say, hey, we're struggling, right? Or there seems to be conflict, or that we're not communicating very well, or whatever, just to be able to say, let's have a discussion, right? So just to give them a chance to maybe communicate what it is, are there external challenges that you're not aware of, or is there are there insecurities that they're dealing with? And I think if you start with, I just want to hear, what do you feel is going well? Okay, so what do you feel is not going well? Do you feel that you have a sense of why, or, just really being curious, but not judgmental in that curiosity of like what's going on, right? So just to give them room to express. I also think of like motivational interviewing in the sense of like, figuring out like where they are. So like, where do they rate themselves in X, whatever maybe area where their struggle. And then, okay, so what do you think you could do? Let's say that they're really struggling with giving feedback to the client, right? So just say, okay, on a scale of 1 to 10, where do you find yourself? Oh, I think I'm at a 5, in terms of like, I'm giving really great feedback is, one end, and it's horrible feedback on the other end, right? So like, okay, I think I'm at a 5. So what do you think you would be doing to be at a 6, right? To get to a 6, or maybe it's even a half step, to get to a 5.5. Like, what would you do differently? In helping them kind of find their own solutions, to what it is that they could do differently or that they could try, so that it's not you saying you need to do blah, 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 right? But where they can say, oh yeah, I could probably try such and such, or I could maybe change this, or yeah, I think my preparation or maybe my planning, that's where I'm faltering, because I'm not giving that planning component enough time, or, so then it's more you listening to them work it out in front of you, right? And then you're like, yeah, that's great. Great plan. Let's do it. That's maybe how I would approach it.
I also, what's coming to mind is something that we learned on the podcast, I think last season. We welcomed, I think it was 3 or 4 guests who talked about mental health in speech pathology graduate students, because there is some research showing that speech pathology graduate students have some of the highest stress rates than compared to, like, I can't remember what the research says, and someone can write in and remind me. It's also in our show notes for that episode. But we have some of the highest stress related issues, some of the most struggling mental health compared to all grad students across allied health. And I think, just based on some of your previous advice about being a human first, just taking a second to consider, hey, if there is this like true conflict where they're upset, or they're, your conversations are contentious, just taking a second to be curious about them as a person, in
Right.
case there are additional things going on with them, or the stress of graduate school is, really wearing on them. And this is the last straw. We've all been there, like, where
Yes.
you telling me not to give feedback for the client is the last straw. And now I'm crying and yelling at you because this is so undeserved, not that things get that dramatic necessarily, but I think it's just worth holding space for that, and all of your suggestions as well, because sometimes things are challenging. And again, just another vote for your original advice, which is investing in that relationship and being a human first, because that's going to facilitate a much better outcome. And I have to also assume prevent some unwanted discomfort and conflict, because if you do have that great foundational relationship, then they may come to you before they get overly stressed, or there's that safe space for vulnerability and asking for help, which is so important.
When you were talking about mental health and just really any condition that student is facing, one thing that came from sometimes instances where students were struggling again and again with something, and you're like, okay, why are you not getting it? It's leading them to other resources that would allow them to figure out. So like, for example, one student did not have an autism diagnosis, and she eventually, through some conversations and just reflection and she ended up going through like an evaluation, and then she realized like, oh my gosh, like this is why I've been struggling my whole life, because I have this undiagnosed, condition that I never knew, right? And she always thought, why can't I get it? So helping them identify like, are there other things going on? Do you need support in another way, whether it's ADHD or whether it's autism, or whether it's, just something else, right? Like sometimes there are other co-occurring things that they have not identified, right, for themselves. And so helping them along. I remember, and this doesn't have to do with a condition, but it had to do with a bilingual student who, even though she grew up in a bilingual home, because she had lost her expressive language in that language, she did not see herself as bilingual. But she wasn't processing her challenges or difficulties that she was having with language to that. And it was like me walking alongside her, and we even like ended up doing some testing and talking through different things to realize like, oh my gosh, like, yes, you are an English language learner. You may not feel that because you don't speak that language anymore. She still had receptive skills in that home language, but she felt so far removed from it that she wasn't viewing herself with that lens. And so it was almost like, because she was experiencing all kinds of like communication apprehension and rehearsing things that she needed to say because she was afraid that it was going to come out wrong. Like there was just like all this mental, like
Cognitive load.
turmoil,
Yeah.
that was happening in meetings and whatever. And then as we talked about it, and as we like probed, and I helped her identify some things, it was like, oh my gosh, like she was a new person because she felt understood, and she felt like, here's the explanation for why I have struggled. Where before she actually said this to me, she's like, I just thought I was dumb. I just thought that I just, she always felt inferior, right? And so just helping her just open this, lens of like, oh, this is why this
Yeah.
is so difficult, so
Our grad students are people too. The moral
exactly.
of the story,
That's
learning about
right.
themselves in a
Yes.
very stressful time. Speech pathology graduate school is so
Oh my
difficult.
gosh.
A
Yeah.
lot of individuals in graduate school are in an earlier phase of life. So, where a lot of things can be in flux, everything from finances to family to housing to all
Right.
the things. So I really appreciate that reframe
Mhm.
in supporting them through their learning journey as three-dimensional people who have lives outside of the clients that they're seeing. And I think that
Right.
that's a great practice to start early in their career.
Mhm.
Before we wrap up, I wonder if you could just give us a few pointers. And in your talking points here, I see that you've got some suggestions for feedback as it relates to report writing. And I'd love to hear a little bit about that before we wrap up today. What can you tell us about feedback for report writing?
Report writing is like what makes us pull our hair out, right? Because again, students come with different skills when it comes to their writing skills. And so one aspect or something that I did was I developed a little rubric that would allow them to go through their writing and think about three different areas. So we talk about content, we talk about clarity, and we talk about conciseness. So I have these phrases essentially that, so for example, where they would, write a report or a progress note or whatever it was, and then they would filter it through this rubric essentially, right? Where they're asking themselves like, have I described my subjective observations and objective data, right? Have I, or it says like, the information I have provided is specific and accurate, or I have used positive language to describe challenges, right? So like just helping them think about the content. Then for clarity is really helping them cover the content in a way that's coherent, in a way that's clear. So for example, using family-friendly language, right? So avoiding maybe a lot of jargon, or but also thinking about the audience. If of course you're writing a report to an insurance company, that's going to look different than it does for a parent, so just thinking about your audience, but also, are you giving tangible examples? So again, it says, it's a declarative. So it'll say, I have made it clear who my referent is in each paragraph, or I have
I
used
feel like I need this rubric.
blah, blah, blah. Yeah.
Yeah, Paula, this sounds very helpful.
But they're doing like a self-check, right? Like I have done this, or, and then with conciseness is really just about, not writing the novel, right? Like give me enough information, but not so much information that, you are going to lose me as the reader. So just what's the most relevant data, being concise, within the sentences, but also descriptive across your paragraphs. And so just thinking about that. And then the last one being just mechanics, right? So making sure that they're checking their spelling and their grammar and their punctuation. And, just I'll
And
tell
not using Chat GPT to write the report somehow.
yes.
Right.
But I'll say to them, I'll say, read it out loud to yourself, because if you read it out loud and it makes no sense, it's not going to make sense to your reader, right? So
Right.
sometimes walking away from it, then reading it again. And so just walking them through that process to really help them improve as writers, and clinical writing, so that they know, again, this is the expectation, and then, I mean, still you have to give gobs of feedback on writing,
Mhm.
but at least it gives them that structure to think about, okay, content, clarity, and conciseness. So what does that mean, and just helping them along in that process, which is really hard.
That's really wonderful. We love a good rubric here. That's really, really helpful. And I also feel like having things written down and having a clear sense of direction, again, back to your explicit instruction, is really, really helpful. And I know you also have some handouts that you are going to put on our website that
Mhm.
are to accompany this episode. So thank you for those. We will link to those in the show notes. Um, do you have any parting words for wisdom for us, for anyone listening who is wanting to be a supervisor, who still is a or who is a supervisor now? What are your parting words of wisdom for us?
I would just say, look this as an opportunity for you to grow too. And if you're wanting to do it, do it. Working with students is wonderful. It's very rewarding. I love it. But then also self-reflect, what are you doing to ensure that, your students are not going to leave grad school, hating the experience? Like, am I going to, encourage them in their love of learning? Am I going to foster that rather than kill it, right? With those 2 years of grad school, and just thinking about, how can I contribute to their well-being and their enjoyment of learning? How can I do that, just on a regular basis, and just helping with just, avoiding the burnout and avoiding the exhaustion of, being a student. Of course, that's a part of grad school, and that's just inherent in the experience. But at the same time, we don't have to add to it, right? We don't have to add to that burnout or to the exhaustion or to even their satisfaction with grad school. We can make a positive impact in the other direction. So I would just encourage supervisors in that sense, and just keep doing what you're doing. It's, we can't do this without clinical supervisors. That's just obviously that goes without saying, and so I'm grateful for everybody who's willing to do that, because it's not for everyone. It's not something that necessarily is, everybody's cup of tea, but for those who are willing to work with students, just keep doing it. Your work means something, it matters, and is impactful. So
Thank you so much for everything today, Anna Paula. This was really so wonderful. For anyone listening who would like to use this episode to earn ASHA CEUs or certificates of completion, the link is in the show notes, along with links to the handouts that Anna Paula has included and offered as accompaniments to today's episode. There is also a list of all of our references and resources. Thank you again so much for being here. We really appreciate it.
I've loved it. Thank you.
Thank you so much for joining us in today's episode. As always, you can use this episode for ASHA CEUs. You can also potentially use this episode for other credits depending on the regulations of your governing body. To determine if this episode will count towards professional development in your area of study, please check in with your governing bodies, or you can go to our website, www.slpnerdcast.com. All of the references and information listed throughout the course of the episode will be listed in the show notes. And as always, if you have any questions, please email us at info@slpnerdcast.com. Thank you so much for joining us, and we hope to welcome you back here again soon.